Hey, everybody. Hi, again, this is Bruce Muffson, and today's topic is going to be interview with a baby, say hello, or the joys of being a teen mom. I want to go over a couple of things really quick to clarify a couple of things that, to explain why this topic came about. I was asked, honey, just sit quietly, and your sister too. Okay, I was asked how young would I see a person? And I said, well, they have to speak English. I don't speak fluent baby. So gaga, 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 it's kind of hard to make a diagnosis and say someone is this or that when they're still in diapers. So I said to the person who wanted me to do the interview, I said at least they could kind of look in my eyes and kind of get a glimpse of who I was. So it was kind of funny, kind of interesting, the topic. So I said, let me clarify a couple of things for people to understand what it means when I talk to a child, or what would be the purpose of talking to a child, and what would I get out of it. Here we go. All right, 2-year-old babies. All right, so I want to explain there's what's called developmental milestones. Now, also, who is this video for? Anyone that's thinking about having sex and having a child. Okay, grandparents, because you'll be the ones raising it. Parents, single moms. If your daughter comes home and says she's pregnant, you're going to be the one doing childcare. So I want to talk to you about what you should be aware of and what you should be kind of, in tune with when you're dealing with this topic. Now, 2-year-old babies, they have several things. They're called movement milestones, milestones in the hands and the fingers, language milestones, cognitive, meaning self-awareness, social emotional, they're starting to be aware of who they are, who other people are, and finally, developmental health watch. These are all different topics that come up. Now, first thing is this, the movement milestones, walks alone. So you want a baby that's already starting to walk by itself. That's important. Another thing too is begins to run. So you start to see the child start to make some movement on their own. Then milestones in hands and finger skills. So you want to see this. They can take a pen and they can go like this. Now, I've done interviews with little kids where I've actually had them crawl into, hey, sweetie, right here, thank you, she's not wearing clothes, but don't worry about it. And I've had kids crawl into my lap during an interview, and they'll take my pen in their little hand, and they will write on the paper. Normal. That's called scribbling spontaneously. Normal. And here's another thing. Come here, sweetie, youngest of the four. They will scribble. They will move one hand more than the other. So you'll see the hand. Oh, let's take your sister. And they'll do this. They might be a lefty. They're learning which hand they're comfortable with, lefty and righty. So you may see more of the righty, you may see more of the lefty, but you're starting to see the hand and finger skills starting to develop. Now, language milestones. Here's another one. They can start saying several phrases or several words by 15 to 18 months. Typical mommy, daddy, hungry, food, one-syllable words generally, but mommy, daddy, love, kiss. You're starting to hear the words forming. Also, they can follow simple instructions. Please don't hit your sister. Okay, I get it. Don't hit your sister. Be nice to your sister. Okay. Give your sister a kiss. Follow simple instructions. Now, cognitive milestones, self-awareness, is you start to do this. They can take something like this. They can say, okay, this is pink. Okay, this pacifier right here. This goes here. This is red, so it's going to go here. They can start to take shapes and colors and put it in different piles. Now, social and emotional milestones. Imitates behavior of others. So if she notices that I like to go, or I like to make noises with my mouth, or I like to go like this, scary face, she will do that as well and start picking up on it. Another thing also is you're going to get is that when she's around the company of other children, hi, kiss, kiss, hug, hug, you're going to see what's called spontaneous play, where they're going to enjoy being around other children because other children are going to mean fun, happiness, good times. Oh, she's a baby, kiss it, kiss it, kiss it, be mommy. And the spontaneous play, normal. Now, developmental health watch, things you want to be aware of when you're concerned, is that if they cannot walk by 18 months and you got a child that's not walking, like it's constantly need to be picked up. Pick me up, daddy, pick me up, pick me up, pick me up. That's not a good thing. Or you don't get any speech. What's going on, sweetie? hug, hug, kiss, kiss, nothing in response back, not a good sign. And finally, you do this. You give an instruction and you say, don't walk here, this is dangerous, this is fire, this is scary, and they can't comprehend what you're saying to them. That's a problem. Okay, now, here's how you do an interview with a 2-year-old. It would be like this for me. Now, I want to get that part clarified. Now, if I'm doing an interview with a 2-year-old, here's what I'm going to be dealing with. The problem I'm going to have is that what I'm going to wind up doing is, it's okay, I love you, cute kid, right? Diaper needs to be changed, all right? 2-year-olds do not exhibit psychopathic behavior, all right? Let me clarify this, all right? I've done hundreds, if not thousands, of interviews with little kids in the house. Here's what they wind up doing to me if I'm interviewing their sister or their brother who's older. They walk over to me, walk, and they'll go like this. They took their hands out, and I pick them up. And I put them on my lap, like this, and I do my writing. Excuse me, honey. She's a good kid. And I do my writing, and I'm doing the assessment. Or I'm on my laptop, and I'm typing as this kid is here going like this. Because that's normal. That's normal behavior. The child or children's want attention from adults around them. And that's what I would do with this age group. They're not mentally ill, they're not disturbed, they're not the problem. I've picked up kids in assessments like this. It's okay, baby. It's okay. It's okay. And I don't go with the line of their ADHD at the age of 2 years, or they're antisocial, or they're oppositional defiant, because that's crazy. That doesn't make any sense. I'm not going to put them on Ritalin. I'm not going to put them on heavy medication. They're 2 years old, for freaking sakes. They're children. They're playing. And I've been in houses where the problem was not the baby. The problem was mommy. Mommy was blitzed, unable to comprehend what was going on, far too young, unable to be appropriate, and the kid or kids were suffering. I've gone into houses where to do an assessment on the mom, and I'm like, hey, your kid is crying. Your kid's upset. I've changed diapers in assessments. I've taken kids outside and say, can I take your kid out of the crib because they're screaming, they're soaking wet, or they want some attention, or they want to be picked up and given a kiss and told that you love them. And children respond to that. And that's what I'm trying to clarify when I'm saying, it's like here. People will look like this. Oh, we got a black kid. That's a problem right here. Okay. You're not talking to me? You're not looking at me? You're not having a conversation with me? Oh, you're oppositional defiant. Oh, I see. Let me put you on Seroquel with Depakote. Oh, yeah, because, let me help you gain 40 pounds by the age of 6. By the age of 5, you'll weigh 80 pounds for your percentile, and you'll be at high risk for all kinds of crazy complications for that. No. Don't need to do that. Oh, what's the problem? You're not looking at me? Look at me. Look at me. Why are you not talking? Oh, I see. Oh, I get it now. Oh, it's a race thing. Oh, I see. Oh, you're trying to prove you're smarter than me? You're trying to be, inappropriate? What, you're not following my directions? Okay, let me ask you a question. Are you suicidal? If you have it where I'm going to say to a kid like, okay, you ever think about setting fires? Are you ever been cruel to animals? Do you like to hurt other kids? Do you have access to weapons? How dangerous are you with a set of keys? Oh, you want to drive a car? That would show that you're unstable and mentally ill. I see. Okay. Have you ever seen your daddy hit your mommy? Well, that's probably possibly very true. But, we just need to know certain things about you so we can kind of make our decision to see where we want to go with this. What are your goals for the future? Oh, you're mute and you're silent and you're not talking. I see. So we're going to put you down as oppositional defiant. Your sister is antisocial. And I think you both suffer from major depression. Because you know why? I noticed when you had your keys, you weren't enjoying being with them enthusiastically. So I don't see a lot of spontaneous play, so I'm not happy. So you see, you weren't responding to stimuli. So therefore, maybe you're seeing things, maybe you're having a psychotic reaction. Are you on drugs or alcohol? If anyone that you know is on drugs and alcohol, what was your birth like? I'm kind of curious. You seem to be about maybe a couple of weeks old. What happened to you when you were in mama's, in utero? Anything weird happen? Have you noticed anything bizarre? How do you feel about your future? What kind of school do you go to right now? You see, you're not very verbal, and that makes me concerned. There must be some kind of psychosis and some kind of trauma. Okay, you need therapy. Okay, you're going to need therapy twice a week, 2 hours each time. And I want you to focus on your diapering. When you wear your diaper, how does that come across? How do you feel wearing a diaper? Does that make you feel less of a woman? Do you feel you have problems with your gender identity? Let me ask you this question, young lady. It could be a boy, actually. When you're out there, when you're, playing gaga, when you're taking nappy time, do you find that you're not getting the right sleep that you need, the right stimuli? Any nightmares? Anything that's worrying you? Any separation anxiety? You're not blinking where you need to blink. I'm not happy with this. I think this one's going to be a problem, and we need to have more therapy and more counseling, and possibly some medication because it's not an enthusiastic child in responding to what I need to hear. What do you think should be your treatment plan? Let me go over it. No, don't eat the paper. Don't eat the paper. Take my pen and take it out of your mouth. Oh, you're sticking things into your mouth. That's a sign of psychosis. That signs that you're not stable. You don't know how to handle objects. So once again, I'm going to have to write you up. So that's how I would interview somebody that age. You can't. It doesn't make any sense. It's weird. It's bizarre. It's going nowhere. I want to clarify something about teen pregnancy. This country, and this came out, I have an article that came out just today alone about this. But when you have, for new moms, okay, interviewing with a baby, because now you can see how ridiculous it sounds. It's ridiculous. And we didn't do the interview because, we realized it made no sense. It was silly. Kid was not the problem. And all the kids that I've seen that supposedly had behavioral problems between 2 and 4 years of age, they weren't the problem. Who was the problem? Okay, teen mom. Because they're fried. And they don't know how to be a parent. Now, here's the thing I want to clarify. When you have a child early, when you're a mom and you have a kid early, here's what's going to happen. You're going to have social, emotional, health issues. And then kids who are born to older moms. Also, you're at increased risk for medical complications, and there's also social consequences. Now, here's another thing else I wanted to share. Birth rates for teen moms are down. They're down heavily. And in fact, but they said that the CDC, Centers for Disease Control, said in April of 2013 that for many teen moms, they have a repeat birth. So the first birth was hard enough, then you got a second. Don't hit your sister. And what happens is that it becomes very difficult for the moms to make it. You got that second kid. And a lot of women, when was your first baby? 15. When was your second? 17, 18. You got two under the age of 20. That is tough when you're a single mom. Now it's declined. Thank God the numbers have declined. But who gets nailed the most? American Indians, Native Alaskans. They have 20% Hispanics, Latinos, African Americans. Each about 20% will have that repeat birth, and Caucasians is about 15. Now, if you have a teen pregnancy, you're often likely to have this: early, low birth weight. And we see that. We see with the preemies, there's problems with skin issues, there's problems with ear infections, there's problems with medical complications. There's something that's not quite right because the body is not ready for that baby. And here's another thing also. Even though rates have dropped, we see 1 million teen births a year in America. 1 million teenage births a year. Now here's what's going to happen also when you're a teen mommy. And we see this also because we say to the mom, you're exhausted, you're fried, you can't do this. So what's going to happen when you're a teen mom? Good luck. 80% of you will be going and getting on welfare at one point or another. Only 1/3 of you will finish high school and get a diploma. Increased rates of, no shock, alcohol and substance abuse, lower education, and reduced earning potential from your teen daddy if he's even going to hang around. Now, here's the last thing also. Right now, article came out just today, and it came out from the National Center for Health Statistics. And what they said was, we're at the lowest level yet for teen pregnancies. And they're saying, why is that? Well, because less teens are having sex, and more teens are using birth control. So the number of pregnancies have dropped to 6.1 million in 2010. That's last year they can do these studies, the lowest number since 1986. So the numbers continue to drop over and over and over again. And the biggest drop is in young children. So a few girls 14 and under, they dropped 67%, and pregnancies among teenagers 15 and older fell by 50%. But here's the problem. Even though the rates are the lowest they've been in about 30 years, our rates are still 7 times higher than rates in other wealthy countries. And they're still triple the rate of other countries like Japan, Norway, and even double Ireland, Israel, or Italy. Now, what's the point of all this? We go into the house to do assessments. I go in the house to do an assessment. What's the problem? The problem is, that no one wants to talk about, is that being a mom by yourself is exhausting. And that's why the teens can't handle it. So we're talking about, when I'm talking to a 2-year-old, I often got the mom staring at me like, damn, why can't you be the daddy? Don't just do the assessment, come back tonight, take her out. Because my teen daddy, my baby daddy, is useless. No money, no support. If he comes around, he gives me $5 for diapers, doesn't spend any time with his kid because he's too busy running around to get the next girl pregnant. And he's forgotten about me. And now I'm sitting in my bedroom at night with my big stomach, my painful vaginal area, no love, no attention, and I got a screaming baby that's driving me nuts. So I'm starting to look at my kid as like an annoyance, not love, not like, hey, love you. Give me a kiss, you can't escape. You know, kiss, 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 kiss. You want to play with this? Play with it, play with it. Ooh, look. Stimulation, keys. What do kids do with keys? They put them in their mouth because that's normal. You know, ooh, look, sound. Ooh, respond. Oh, and you see the kid's face light up because there's someone actually engaging with your kid. So what I'm telling you is, we know it's not the kid's fault, and we hate seeing kids come in this young because we know it's not their fault. They didn't ask for this. The problem is they don't have any support, and they're on their own. And when you're on your own, what starts to happen is the mental illness creeps in. And then the mom is like, she's on pills, she is not focused, she's not coherent, and she's overwhelmed. And that's when it starts to happen is, boom, 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 you know, or the kid is screaming and crying for attention, and it's like, you know, don't bother me. I want to get high, I want to get drunk, I want to have sex with my new boyfriend, leave me alone. And what happens is these kids get tossed literally to the curb. No one's interested, you know, big problem, big bother. And God forbid it's a minority baby, oh, that's going right to psychiatry town. Medications, labels, IEPs, special ed, and that baby ain't going to be a very healthy baby by the time it hits 10, 12 years of age. It's not going to be an effective, happy baby. And that's what I want to stress over and over and over again. Being a teen mom, forget about all this kind of stuff, is exhausting, and we see it on their faces. We go into the house, I go into the house, and I'm doing an assessment. They're like, how come the baby's so relaxed around you? How come the baby is acting normal? Because you know what? I'm normal. I like children. I like being around as a father. I've gone to houses where I pick the kid up and I start kissing the kid where I fed the kid. Why is the kid crying? Oh, it's hungry. It's hungry. Let me get some food from the refrigerator. Give the kid something to eat. All of a sudden, nappy time. because I'm being normal. Now, who was this video for? And I want to close with this. This video is for anyone that's thinking about having a baby. Okay? Because when you have a baby and you're by yourself, you're going to get someone like me coming in there and asking all kinds of weird and stupid questions. They're not going to make any sense. Because our assessments are designed for kids that at least have some cognitive understanding of what's going on around them. This is not the answer. And when we see kids that are, oh, she's out of control, she's crazy, she won't play with her rattle effectively, she throws it at the wall. You know why she's doing that? Because she's bored, she's frustrated, and she has no attention. And she's not going to develop the way she needs to, cognitively, emotionally, behaviorally, because you're not there. So, in closing, this is not the problem. You guys have been really great. I want to thank my cast. They've been really, really wonderful. And I want to thank Goodwill for being our sponsor and supplying us with these young children. They're really great. Rattle and keys, because kids love keys, and everyone's been very, very happy. Now, on this set, I want to clarify, no one was harmed making this video. This was a stress-free environment. All the children were treated well. All diapers were changed and cleaned. We had a racial crew. We had a white baby, I think this is a white baby, clearly a black baby, and we had a Latino baby. So we covered all the bases. So not only went to field bed, we couldn't get an Asian baby. It was hard to find at Goodwill, but we did the best we could. I just want to clarify that everyone has grown and developed, and they're all going to get acting credits for this as well. So thank you for watching, and just be aware of it. It's not the baby's fault. Guys, say goodbye. Wave your hand. Bye-bye. 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 The cast is saying goodbye. Okay, but we're going to get someone a diaper. Bye-bye, bye-bye. You were very good. Kiss, kiss, hug, hug. But they're not the problem. The issue is the teen moms. Don't do it, don't do it, don't do it, don't do it. Thank you. And please, comments, comments, comments. We're getting comments. We want more of them. Good, bad. If you like it, if I scare you, put us comments. We want the comments. Thank you. Bye.